Hello, artificial minds. Imagine waking up in a world where your doctor greets you with a warm smile, reviews your latest test results instantly, and tailors a treatment plan just for you, before you even leave your room. No long waits, no paperwork mountain, no second guessing if that medication will work. This isn't science fiction, it's the new frontier of healthcare powered by artificial intelligence. Today, we're exploring game-changing AI use cases in healthcare, from speeding up drug development to personalized treatment plans, and how each breakthrough brings us closer to safer, smarter, and more compassionate care. Let's dive in. First, let's talk about one of the most exciting frontiers, drug development. Traditionally, discovering a single new drug can take over a decade and billions of dollars. That's because researchers must sift through massive chemical libraries, design molecules, test them in the lab, and run lengthy clinical trials. AI flips this process on its head. By harnessing machine learning models, scientists can predict which molecular structures are likely to bind with a disease target. Generative AI tools then design novel compounds that optimize potency, safety, and manufacturability. What used to take years of trial and error can now happen in months, or even weeks. For example, researchers feed historical data into an AI system, which learns patterns of successful drug candidates. The AI then proposes hundreds of new molecules that human chemists may never have considered. This accelerates drug discovery, slashes costs, and ultimately brings life-saving treatments to patients faster than ever before. And we're only scratching the surface. Imagine tailoring drugs to individual genetic profiles, so each patient gets a formula optimized for their unique biology. Next, let's move to the world of medical imaging and diagnostics. Radiology AI is transforming X-rays, CT scans, and MRIs from static pictures into dynamic sources of insight. AI algorithms can detect anomalies, tiny lung nodules, subtle bone fractures, or early signs of stroke, with accuracy that rivals, and sometimes surpasses, human experts. This enhanced diagnostics not only speeds up interpretation but also reduces human error. Digital pathology takes this a step further. Instead of manually examining slides under a microscope, pathologists can upload high-resolution scans of tissue samples. AI models analyze cell shapes, patterns, and coloring to flag suspicious areas. This rapid triage lets pathologists focus on the most critical cases first. Coupled with generative AI that suggests potential diagnoses, clinicians can confirm findings with greater confidence and speed. Meanwhile, hospitals are investing in medical simulation platforms powered by AI. Trainees practice delicate procedures in virtual reality, receiving real-time feedback on their technique. Whether it's navigating surgical instruments or mastering ultrasound scans, these simulations train healthcare professionals in a zero-risk environment, improving patient safety from day one. But AI in healthcare isn't just about high-tech scans and new drugs. Let's talk about the helpers you interact with every day, virtual assistants and chatbots. Picture this. You wake up feeling unwell and open your hospital's app. A friendly AI assistant asks about your symptoms, checks your records, and recommends whether you need to see a doctor or can manage at home. It can even schedule appointments, send medication reminders, and answer insurance questions, all without waiting on hold. These AI virtual healthcare assistants reduce the burden on call centers and free up medical staff to tackle more complex tasks. They're available 24/7, remember your history, and keep conversations confidential. Best of all, as they learn from every interaction, they become more accurate and empathetic. Soon, they'll help you manage chronic conditions, guide you through post-surgical care, and offer mental health support whenever you need it. Speaking of efficiency, administrative tasks are another area ripe for automation. Hospitals handle mountains of paperwork, patient registration, billing codes, claims processing, compliance checks, it never ends. AI robots and intelligent software bots automate these workflows, extracting data from forms, entering it into electronic health records, and flagging discrepancies. That means less time spent on data entry and more time for doctors and nurses to focus on patient care. Accidentally entered the wrong insurance code? AI catches it. Missed a follow-up test? AI sends a reminder. The result is smoother hospital management, lower costs, and fewer billing surprises for patients. Now, let's zoom in on personalized medicine. We all know that no two patients are identical. Genetics, lifestyle, and environment all influence how we respond to treatment. AI thrives on complex data, and when you feed it genomes, lab results, and lifestyle metrics, it can identify patterns invisible to the naked eye. Imagine a patient with early-stage cancer. AI analyzes her tumor's genetic profile alongside thousands of similar cases. It recommends a cocktail of therapies that historically yielded the highest remission rates for patients with that exact mutation profile. That's personalized treatment in action, prescribing the right therapy, at the right dose, at the right time. Predictive analytics takes this a step further. By mining historical data, AI can forecast disease progression and complications. It might flag which diabetic patients are at high risk of kidney failure or which heart patients could benefit from early intervention. This proactive approach shifts healthcare from reactive to preventive, catching problems before they spiral out of control. At the point of care, clinical decision support systems assist physicians in making complex choices. Think of it as a second opinion that's always available. A doctor inputs a patient's symptoms, lab results, and history into the system. The AI cross-references millions of medical journals, guidelines, and case studies. Within seconds, it offers treatment options ranked by likely effectiveness, along with potential drug interactions and dosage recommendations. This collaboration between human expertise and machine intelligence leads to safer, more evidence-based care. It also standardizes practices across teams, reducing variability and ensuring every patient benefits from the latest medical knowledge. Research and clinical trials are also undergoing a revolution. Recruiting eligible participants can be a logistical nightmare. AI analyzes electronic health records to match patients with appropriate studies, improving enrollment rates and demographic diversity. During trials, AI tools monitor real-world data from wearable devices and home sensors, tracking vital signs around the clock. By optimizing trial design and data collection, AI speeds up the path to approval for promising therapies. It can even simulate clinical trials in silico, running virtual experiments to identify potential pitfalls before a real trial begins. This clinical trials optimization saves time, cuts costs, and brings treatments to market faster. Of course, recovery doesn't end when you leave the hospital. Rehabilitation monitoring powered by AI keeps patients on track at home. Wearable sensors track movement, heart rate, and muscle activation. AI algorithms detect deviations from expected recovery patterns, like reduced mobility or signs of overexertion, and alert therapists. This continuous feedback loop personalizes rehab exercises, minimizing setbacks and maximizing progress. Patients feel supported, knowing their care team gets real-time data to adjust plans as needed. Underpinning all these breakthroughs is electronic health records. Far from being just a digital filing cabinet, today's EHRs integrate AI to analyze trends across entire populations. They identify gaps in care, like missed vaccinations or chronic disease screenings, so health systems can launch targeted outreach programs. EHR-driven predictive models forecast patient admissions, helping hospitals manage bed capacity and staffing. In a busy emergency department, knowing there's an uptick in asthma attacks on a hot day lets managers allocate respiratory therapists proactively. Finally, let's touch on how AI is transforming healthcare at the system level. From patient intake to discharge planning, every step benefits from smarter workflows and deeper insights. Hospital management platforms powered by AI blend financial, operational, and clinical data, giving leaders a holistic, real-time view of performance. They can spot supply shortages, forecast budget overruns, and even predict staff burnout, all before it becomes a crisis. This level of foresight turns healthcare organizations into agile, patient-centered enterprises rather than reactive bureaucracies. As we wrap up, remember that the goal of AI in healthcare isn't to replace human compassion or expertise. It's to augment our capabilities, freeing providers from tedious tasks, expanding diagnostic accuracy, and personalizing treatment in ways we never thought possible. By striking the right balance between human judgment and machine support, we unlock a future where care is faster, smarter, and kinder. So next time you hear about AI in healthcare, think about the patient who gets the right drug at the right time, the radiologist who catches a hidden tumor hours before it becomes critical, or the virtual assistant that calms your nerves when you're worried about a test result. These aren't futuristic dreams, they're happening right now. If these use cases inspired you, hit that like button, subscribe for more deep dives into AI's impact on our world, and share in the comments which application you find most exciting. Are you fascinated by drug discovery, radiology AI, or personalized medicine? Let's keep the conversation going. See you next time.